for some treatment to his acne scarring today. We're doing the dermapen microneedling. Microneedling is really good for breaking up scar tissue and just stimulating new collagen to form. So microneedling is really good for fine lines, just overall rejuvenation of the skin as well. It's not just limited to acne scarring, but it is one of the best treatments for acne scarring. So today we're just working on these little bits here, just to break up this tissue and just rejuvenate the skin. So we'll get really good results from one treatment. We do recommend a course, but one treatment you will see results with scarring. Yeah, Kirby's super not impressed about the lip thing next week.
Hi, this is Dr. Sarah Kennea at Whistle Medical Aesthetics. We are going to take some blood for PRP today. And you've already had some microneedling done, and so we're going to take some blood to put some PRP on the face, if that's right. So when we do microneedling, we make lots of little channels into the skin, and so they remain open for a little bit of time, and so that gives us the opportunity to put PRP on, and then that will go in through the little channels and kind of help with that healing process. Okay, so really sharp scratch. So PRP is platelet-rich plasma, and it's when we spin down blood, all the big heavy red blood cells go to the bottom, the white cells go on top of that, and on top is left the serum, which is all the good stuff that's full of all your natural growth factors. And so we can put that on the face without it looking too crazy.
Interesting.
And it will help with the healing process after your microneedling. So the next stage, we're going to use a cell-filled tube, which comes all packaged in a sterile environment like this to make sure it's nice and clean. And this has a special gel that separates out the cells from the platelet-rich plasma. So there are lots of uses for PRP. We can inject it directly into beneath the tissues, particularly this is good for under eyes when they need redensification. If people have got hollows or if they've got dark circles, it's great for reducing darkness. So we just shake this about 7 times, and then in there I've already got my balancing tube, which balances it out, and then I put the tube with the blood, and then we press the button for PRP. And then in 6 minutes, we will have our platelet-rich plasma. So our 6 minutes is up. And we're going to open up and see how our PRP is getting on. And as you can see, we have separated red blood cells. Then there's the gel with the white blood cells. And here is the plasma, which has platelets in it, which we're then going to use for its natural growth factors. Sometimes we can activate the PRP, which is said to enhance the action of the platelets, and that's done with calcium. We're not going to on this occasion, but say we were going to do an under eye treatment, we might want to activate the PRP just to get maximum biological activity from it. That's great, and we have our 3.5 mils that we're going to put topically on Chris to finish off his microneedling technique. So now we're going to put on the PRP on the skin, and it is always surprising how well the skin absorbs this after a microneedling procedure. So these little channels that the microneedles make in the skin really do suck up anything topical that you put on the skin at this point, and that's what really allows us to make it a quite versatile treatment. So if we want to be treating pigment, we can use anti-pigment agents. If we want to be treating wrinkles, we can use retinols. The PRP is just great for enhancing the recovery time after any reason for microneedling. I've had some pretty impressive results with scarring over the years with patients. You literally do just break down that scar and then cause the body to come in and build new collagen. And that completes your microneedling with PRP treatment.
Thank